Friends, I'm Dr. Hitender Ahooja, and I'll be talking on protecting and taking care of your eyesight for next few minutes. And as we all know that eye is a very important, I think it's the most important sensory organ, and vision. We know how important it is. It's a window to the world. Basically the world, we can see the light around and we can see the colors around. So basically many of our memories are determined by what we see, and they are stored in our brain, and that's how we correlate things of the past. And about the World Eyesight Day, World Eyesight Day is a annual global event which draws attention on blindness and visual impairment. And the basic objective is to create awareness about eye care, the causes of visual blindness, to talk about preventable blindness, and how to take care of this uh, basic diseases, and so that all can see. And this day is focused on drawing attention to leading causes of blindness or visual impairment, like the most common cause of blindness, which accounts for about 55%, is cataract. And then comes in the list is glaucoma and refractive error, etc. And as we all know, basically there are 2.2 million billion, sorry, blind people who have unaddressed vision, uh, or the blindness, and about 1 million people have vision impairment which could have been avoided and yet to be addressed. Basically, that's the importance of this day. That's what we are trying to kind of make aware uh, the whole of the world about this. That yes, the bad news is that so many people are blind, but the good news is that this can be kind of taken care. And more than 1 lakh corneal transplants are required annually in India. Uh, and uh, and one of the important thing to remember here is that there are, about this corneal blindness, is that a lot of this corneal blind are children, about 20%. And the current transplant situation is just 25,000 per annum. And so you can judge that how big is the waiting list, and how many years, about 100 years, if it can take to reach our goal, if we kind of go at the same pace. So really we need to improve our pace. And it's not only that, this about the cornea, there are various kind of things attached to it. That corneal blindness happens in the productive year of life. It happens in, basically, really take the in happens in the family, family is, and is, it keeps on increasing. And that's how it impacts not only the individual but the whole family, the whole society. So that we have to understand. And for this we need basically the cornea donors. And the cornea donors can only be increased by increasing the awareness, by the subsequent presentation. And sight and vision: sight is physical, that sensory experience in which the light reflects all objects, and eyes then focus this light. Signals are sent to the brain, converted into images. This is all physics, basically. And so the protecting your eyes and your sight is highly important, so that you may avoid the harms, and the light can reach the brain and we may see this beautiful world. And just to have a brief look at the anatomy of the eye: the outermost layer, the thin layer, then as we go inside, then comes the iris, the round thing which we see which dilates during the dim light, the pupil, and constrict during the light. It's known as pupil, and the lens, which is kind of helping us see during the near and the distance vision. And when it becomes opaque, it is known as cataract. Behind that, it is vitreous jelly, and then the retina on which the image is formed, and then the optic nerve which takes the image to the brain, and finally we are able to see this colorful world. And if we talk about the common eye problems, it could be different in children and geriatric age group. Refractive error like astigmatism, myopia, hyperopia, the dry eye, the digital strain in the eye is becoming more and more common these days because of the use of laptop, computers, and all the gadgets. The allergy, it it varies from place to place. It's more common in the dry places that where the temperature and the climate is the temperature is high, and the color blindness and the night blindness are all or the congenital diseases. And other common issues in children is lazy eye, that is amblyopia, and by if it's not corrected at right time, the eye turns to be lazy, and it's best to correct this before the age of 8 years. And after 8 to 10 years, it's very difficult to take care of this amblyopia. The vision permanently is decreased, and squint, we all know, is the deviation of eyes. It can be outwards, inwards, upwards, and downwards. And by the ptosis we mean the drooping of the eyelids. When the eyelids kind of droops, it can be in both eyes or it can be in one eye. It can be acquired, it can be congenital. By this I mean it can be present by birth, or there are various causes also which can lead to this problem of ptosis. And the other problems in the older age group is presbyopia, which we see commonly that patient require near vision glasses after the age of 40. The cataracts, we all understand, when the lens which we saw in the anatomy becomes hazy because of age. At this moment, we are talking about the aging problem. It's known as cataract. And glaucoma, commonly known as kala motia in the northern part of the India. When the pressure of the eye goes high, it is known as glaucoma. Age-related macular degeneration, when the macula degenerates, that's the place where the which is responsible for maximum vision. It is known as age-related macular degeneration. And when the retina, the blood vessels are affected by the diabetes, it's known as diabetic retinopathy. And if it is not corrected, if it is not lasered or it's not treated on time, that can really lead to blinding complications. Myopia we see very commonly, and we all know, we are taught in our class 5, class 6 standard. It's basically nearsightedness, and in this case, things are which are near looks clear, and far objects looks blurry, and this can be corrected by simple glasses, contact lenses, or basically after the age of 18 years can be corrected by lasers or implantable contact lenses. Hyperopia is another refractive error known as far-sightedness. Distant objects are clear and the near objects are blurry. Here, the eyeball is shorter as compared to the normal eye, and the treatment remains the same as for the any refractive error. That is the glasses, the contact lenses, and over the age of 18, it can be corrected with the lasers or the intraocular lenses of various types. Amblyopia, we have talked about previously. Amblyopia, to reach stress, basically it's a lazy eye, it's a very important issue, and it requires, therefore lies the importance of the school screening programs. And when it's the refractive errors are picked up at the right age, the simple glasses can take care of this problem. This will not lead to this lazy eye, and when they are not caught at the right age, this can really uh, be a problem which at the right age, even the best of the medicine, the surgeries, nothing can treat it. Only the timely intervention can help prevent this lazy eye. Astigmatism basically is another refractive error, and the management is same as the glasses, contact lenses, or the refractive surgery after the age of 18. Squint also should be managed as if neglected. Sometimes the simple glasses can required, but yes, as soon as the squint is noted, the ophthalmologist should be contacted and the appropriate therapy should be instituted. And the droopy eye ptosis, as we were talking, this is basically the lowering of the lid. It can be congenital, that can be present from the birth, or it can be acquired. There are various causes which can lead to this droopy eye ptosis, and according to the cause, the intervention is designed. Corneal ulcers can be a cause of the corneal blindness, and if not taken care properly at appropriate age, this can make the cornea wide, or even can lead to this melting of the cornea, which can be a real problem. And the exact the microbiology, by which I mean the exact bug, uh, whether it is bacterial, fungal, or parasitic, should be uh, kind of basically seen, and the depending on the bug, basically the right therapy should be instituted, and if medication don't help, the surgery should be uh, that is the corneal transplant should be done. The infected cornea should be replaced with the normal cornea which comes by the from the donor. Conjunctivitis, we mean when the conjunctiva, the white part of the cornea is gets pink. It's known as pink eye, and it's very common thing we see during the hot and humid climate. Mostly it is viral, but should not be taken lightly, because if the cornea is involved, that can really lead to problems, and the doctor, the ophthalmologist should take simple problems and should not be taken easily or lightly. Cataracts, we all know, it is the most common cause of blindness, and has a very easy way of managing these days. The surgery has become quite fast, and rather than visual rehabilitative surgery, it's become refractive surgery now. And the other causes of this cataract, other than the aging, can be eye injuries, or high alcohol consumption, and all those stuff can lead to early cataract. The diabetes can lead to early cataracts, but no glass prescription can take care of this cataract. Cataract or motiabin can be taken care only by the surgery, which I said is quite simple these days. The common way of doing this cataract is the phacoemulsification, and we take this cloudy lens out and put a intraocular lens inside the eye, and it remains there for life. And glaucoma, also known as kala mutia. Here basically what happens is the intraocular pressure goes high, and it's also known as a silent killer. And because the patient doesn't feel sometime any pain or any redness, it just the pressure goes on killing your optic nerve. And its optic nerve damage is reversible. So the whole idea is to get the regular eye checkups after the age of 40, at least a yearly checkup. And if somebody has a family history of glaucoma, then the whole family should be screened, because then the chances of other members getting glaucoma, this silent thief, is very high, and it can be taken care by simple medication, laser surgery, or the invasive surgery to gonioscopy and perimetry to monitor the glaucoma, to check the progression of the glaucoma. And medication has once started, it has to be put. Various advanced surgeries available which can really help maintain the intraocular pressure, and thus the optic nerve can be prevented from damages. Age related macular degeneration once had no treatment, but now there are various injections known as anti VEGFs, which are very good, and patient might require it repeatedly, but then it helps the patient from going blind. And the OCT and the fluorescent angiography are the two diagnostic tools which help kind of make the age-related macular degeneration. And there are two types: the dry and the wet. And the dry has no issues, only the wet is dangerous and requires observation. And about few words about diabetic retinopathy. Diabetic retinopathy is a very dangerous situation, but if managed properly at proper time, and the proper visits to the doctor are maintained, and the diabetes is controlled, and the proper lasers and all these things are instituted at right time, then I think that can avoid the irreversible blindness. And the eye strain, which we see these days very commonly, and more commonly in this COVID era, the as the use of gadgets has increased, so we sit on the laptops and gadgets for a long time, that makes our eye dry. And though we should be knowing about it, what it actually this is: the blurred vision, the eye irritation, stinging sensation, watery eye, headache, and disorientation, difficulty digital devices increase this eye strain. And it's also known as computer vision syndrome. And there are various symptoms. There is difficulty in reading, and that can impact whole our system, whatever we do in our daily life. And tips to prevent: basically we should be maintained at a proper distance, that is 25 inches. The brightness should be low, and there's a rule of 20-20. Basically, after every 20 minutes, we should blink, or we should kind of take our eyes from the screen for 20 seconds. We should wash our eyes regularly. And basically the desktop, and all the turning off some of the overhead lights while the working on that, so that decreases the glare, and the contrast is much better. And we should try to blink more and more looking at the monitor. Hence, seeing all this, there is need for regular eye checkups, and each test should evaluate different aspects an eye examination help detect eye problem at the early stage, and regular eye checkups helps early detection of eye disease, and I help them treat better. And this point we have emphasized during the in the slide on the eye uh, on the problem of corneal blindness, that there is a big gap between the what we are getting from the eye donation and the number of patients those are waiting. So it makes all sense to talk about eye donation, and we should all pledge our eyes. And after death, there's no use; it will be buried or burned. But if we kind of donate our eyes, it will be used for somebody who's waiting, who has corneal blindness, and then after his transplants can see this beautiful, colorful world. Thank you.
Thank you so much, sir. Thank you so much for giving your valuable time, sir. Thank you so much.
Thank you.
गुड इवनिंग
थैंक यू
सर।
सर।
Hello, how are
हाय
you?
सर, विपिन सर।
Hello.
बिल्कुल ठीक हूँ मैं सर।